we have this examination of mentally ill patients. If somebody say that I want to kill myself, we make an assessment.
Okay.
What if the assessment means that we want to know whether he is telling that due to a mental illness or not.
Okay.
Or if it is depression, we go for other features. We investigate for the other features whether this person is having those things. And the other thing, with regard to this expression idea, we ask about their thoughts. We ask how frequent they get,
Okay.
how intense they get, have they got plans, have they got past events. In fact, our assessment is not 100% correct, but we come to a reasonable assumption that there is a high suicidal risk, therefore we treat them.
Okay.
The other thing is, the expression themselves is not 100%. It's only up to 80% people tell.
Yes.
Others do not tell.
Yes.
But it is not only that they tell, we ask them. In fact, people think that if we ask, are we proposing it? No. We have to ask it.
So there is no power of suggestion here at all?
No, there is no suggestion.
Okay.
That is not has been that has not been observed.
Okay.
If we ask it, that does not provoke. Okay, therefore we need to ask if the patient is depression. It is an essential question. Have you ever had thought of killing yourself? Have you got plans? How often you get thoughts? Those are the things that we do in our assessment, depending on the answers that we get from the patient, and also the severity of this. If they say that it is hopeless to live, there is no point in living on this earth, those are the indications of suicidal idea. Okay, if they have plans, some people they come and they tell that they have plans. Therefore, we go for treatment. They
actually open up and say.
Yes.
But as in, do they open up to a family member, to your therapist?
Therapist.
Okay.
Also, they may open up to the family member if they ask.
I see.
Then the essence in immediate treatment is necessary. Okay. Therefore, it is essential that we inquire, even if they don't tell it.
Yes.
If the patient is depressed or having other mental illness that he says that they are hopeless or worthless living, we need to inquire into the fact whether they have suicidal ideas or plans and treat it. It is an essential component of assessment of mentally ill patient and treatment.
Doctor, I have a question in terms of the sort of demographic differences in terms of age. Now, what is the sort of breakup in Sri Lanka for suicide rates in terms of age?
In fact, there are two periods, that's especially in young adults and in old age. Okay. Young adults, again, in both ages, it is common in male. Okay. And those are the two demographic data. In fact, in old age, the intention is different. Now, in old age, sometimes people are alone. Actually, there is no hope of living.
Yes.
They are having physical illnesses and depression associated with physical illnesses, and the care is poor, and they really sometimes get depressed. And more than the depression, now how long that they are going to live, that idea also comes in, that philosophical thought comes into mind, and suicide in old age is higher than the other ages. Okay, therefore, now suicide, now some people argue that should suicide be prevented, in really that there is no point of living for that person at that age and that social context. Children are not with them, lot of physical illnesses and no other resources, so what? Those are arguments, but that doesn't mean that we should encourage suicides. In fact, the main principle that due to sanctity of life, we need to prevent suicide. But various philosophical ideologies comes at the age of, say, last stages, 87, 90, suffering from lot of illnesses, nobody to care whether to kill or not, whether to live or not. Can anybody answer that question? Is a problem.
That's true. Doctor, taking into consideration the fact that Sri Lanka is an aging population, what are the measures that are available right now for people who are in the latter part of their life, if they are going through depression, if they're going through this thing, to feel a little empowered, to avoid these things? What are the measures that are available?
Yeah, aging population is a problem of good health care because they do not die early. They grow up in age, and one of the main illness that you know that it is dementia, or Alzheimer's dementia or vascular dementia. This dementia is almost always associated with depression. That depression is not due to dementia. Depression is an integral part of dementia because of the chemical changes that occur in the brain causes dementia plus depression. Therefore, in the old age, various mental illnesses, depression, anxiety, and other delusions, psychosis associated with dementia is commoner in elderly population. Therefore, mental health issues are prevalent in old age, but there are various proposals that Health Ministry is taking that they should start new courses in Postgraduate Institute of Medicine. They want to train new professionals. Those things are there. But at the moment, a population is aging. There is no such services in place at the moment, but there are a lot of proposals. Health Ministry and the Postgraduate Institute of Medicine, they have considering those things.
I see. Ma'am, from a sociological perspective, what are the measures that are being proposed, or what are the measures that they think should be implemented to take care of like the aging population, and especially to prevent them from committing suicide?
Yeah, one of the things could be to sort of incorporate, or rather to strengthen the family unit. Like we see a lot of migration happening. We see a lot of people, old people being left here, and their children have migrated, so they don't have that support network, and that is one of the main reasons, this isolation and loneliness that leads to all this dementia and depression and everything. So if we could kind of retain the family unit and bring back values that we used to have of looking after the old, that was one of the very prominent things in our society some time back. Then I guess we should be okay with this. But then that's difficult to come to, or rather it's not practicable in that sense, because with the globalization and with the way things are moving. So I suppose we have to kind of educate the old about and
increase the mental health education, and
more than mental health, I would say communication, how to use internet, how to use email, and bring like we have daycares for children, we could also have daycares for the old age, so that they get to meet their own peers. So building social cohesion would be one of the things that I, as a social scientist, would suggest.
On that note, we have to take another short commercial break, but we will see you on the other side. Good morning and welcome back to GMSL. We're on the last part of our show, and we have two experts here to discuss the very serious issue of suicide. And my next question, I'm so sorry about my sniffles because I'm afraid I'm suffering from a bit of a cold. Doctor, my next question is to you with regard to parents. Like, for example, is there a sort of tendency for suicide to be a sort of DNA issue? If by any chance the parents have suffered from this kind of problem, will the children also be suicidal Is that a danger?
Yes, definitely. The mental illnesses are mostly decided by the genetic factors.
Okay.
Okay. And if you take a schizophrenia or bipolar affective disorder, it is almost 90% due to genetic. But the depression, the commonest cause of suicide, is not, the genetic factors are not that high, but it is approximately about 40 to 50%.
Okay.
Therefore, it goes by family, goes through the families, is very high.
Okay.
In fact, if there is a family history of suicide, the suicidal risk of that person that we assess we consider is very high. In fact, now they consider that there is a specific gene that they kill themselves.
Okay.
That's a specific gene. Therefore, the suicides going in families.
I see.
Okay, there's the mental illnesses going in families. The associated symptoms such as suicide in relation to those mental illnesses going in families. Those are genetically determined illnesses.
I see. Does that negate the sort of sociological perspective of that, or Dr.
No, I would say that that would be the biomedical expression of it, but not the sociological. I mean, we would say that it's not, there could never be a DNA, but of course if it's researched and if that's the knowledge, we can't say it's never going to be like that. But of course, even if you do have your genes, I mean, even if you look at the other options, there is like we say diabetes is genetic, but then it's not like you wouldn't find a person who does not have diabetes even though the parents and the grandparents had diabetes.
Exactly.
So we can't 100% say that it's biomedical.
Yes, that's true.
So it has other social cultural factors that factor into all of this. So same goes for suicide.
I have to clarify that one point.
Yes, of course. Yes, doctor.
But just because somebody is having gene does not mean that he get the illness.
Okay.
Gene makes the person vulnerable for the illness.
Okay.
Vulnerable for the illness. Therefore, the gene, social or gene environmental interaction causes the illness.
I see. So both these disciplines
Both
actually
must be there.
I see.
Okay.
All right.
But in most of the mental illnesses, the environmental factors are not the rain or the wind or the other economical factors. Those factors may be infections inside the uterus, or the oxygen supply to the brain during the birth canal,
okay,
or the infection to the brain soon after the delivery, and all. Those are the environmental factors.
Yes.
For the major mental illnesses. Perhaps in depression, other societal factors may attribute.
Yes.
Perhaps. Now, depression is common in pregnant mothers and soon after the delivery.
Okay.
If a mother is depressed during the pregnancy, that has significant effect on the fetus.
I see.
The formation of the brain is affected. Therefore, during the fetus is inside the womb, that is the causation for the depression in later life. Those are the environmental factors that we described. Okay. Therefore, it has to be very clearly remembered that the gene environmental interaction is the cause for the mental illness, and the environmental factors are those things that we described.
I see. We actually have a very interesting video ready for you. It's an empowering video that will discuss the importance of life and the importance of being alive, really. So we'll just take a look at that.